Welcome to this brief video on the herbal formula, Chinese Angelica Decoction to tonify the blood, or Xue Tang. Xue Tang is a formula prescribed for women experiencing severe blood loss in menstruation or after childbirth. Although it only consists of 2 herbs, discussing it brings up a number of interesting points, including the idea of using qi to resolve a blood issue. This formula was first presented by Li Dongyuan, founder of the spleen and stomach school, in his 13th century book, clarifying doubts about damage from internal and external causes. Xue Tang is categorized as a tonifying formula, more specifically as a blood or blood and qi tonifying formula. We can make a quick comparison with the formula Xue Tang or the 4-substance decoction, which you can review in my video which I reference below. Xue Tang is one of the simplest formulas in the Chinese pharmacopoeia, consisting of just 2 herbs. This contrasts with Xue Tang, which uses 4 herbs, all of which relate to and focus on tonifying blood. Xue Tang uses one of the blood tonifying herbs in Xue Tang, but it also relies on a qi supplementing herb. Furthermore, while similar amounts of each constituent herb are used in Xue Tang, Xue Tang uses considerably more of the qi supplementing herb. So we can understand Xue Tang as a formula that can be used on a long-term basis to deal with fatigue and blood stagnation, while Xue Tang is used in more severe cases of blood loss. It should also be noted that the formula can be used for the treatment of sores that are not healing naturally. The 2 herbs used in the formula are Dangui or Chinese Angelica and Huangqi or astragalus root. Dangui tonifies blood, Huangqi supplements qi. As a small aside, you can note that the qi in Huangqi does not have the same character or pronunciation as the energetic qi which it engenders. Dangui is Chinese Angelica root and has been known in the West under a number of different spellings. It has an oily texture with a distinct smell. It is usually cut into long strips. Its properties are sweet, acrid, and warm. It is associated with the heart, liver, and spleen channels. You'll remember from the 5 transformations diagram that the sweet property is associated with the spleen channel. The characteristics of Dangui are that it both tonifies and invigorates the blood, with more emphasis on the tonification. It also regulates menstruation and alleviates or stops pain. You should be careful about using Dangui if the patient suffers from diarrhea and abdominal fullness. The patient may show a tongue with a thick coating, which would imply dampness. You will also need to be careful about using Dangui if the patient is taking certain Western medicines or supplements. Huangqi is astragalus root. In contrast to Dangui, it has a dry texture, no smell, and feels very light. Its properties are that it is sweet and slightly warm. As a qi-enhancing herb, it is associated with the lungs and spleen. And again from the 5 transformations diagram, we can note that the sweet property is associated with the spleen. Huangqi tonifies spleen and lung qi, and in general it raises yang qi. It stops sweat by securing the exterior. It facilitates urination by disinhibiting water, disperses swelling, promotes the secretion of fluids and nourishes the blood. It also generates flesh and promotes the discharge of pus, which accounts for the formula's usefulness in treating sores. However, it is inappropriate in the early stages of treating sores or after sores have ulcerated. When we look at these 2 herbs together, we can see that they have a number of properties in common. They're working in concert to tonify the body. They both work on the spleen, which in Chinese medicine is the key organ for transforming our food into the energy and materials that our body needs. By contrast, Dangui focuses on the blood, while Huangqi focuses on the qi. The action of Xue Tang is to supplement qi and generate blood. The original purpose of the formula was to treat a syndrome called Lao Juan, which can be translated as consumptive, exhaustion, or taxation fatigue. This condition would be a result of extreme physical stress and malnutrition, usually caused by the forced labor and lack of nourishment that Chinese peasants would have to endure in those times. These extreme conditions of fatigue would give rise to the following signs and symptoms: a red face, hot sensations in the muscle and skin, fever and headache, irritability, thirst with a preference for warm beverages, a pale tongue, and a flooding, large and deficient pulse that is forceless when pressed hard. The classical TCM explanation was that Lao Juan was injury to both Yuan qi and nutritive qi, leading to extreme blood deficiency. Deficient yin is unable to contain the floating yang qi, resulting in the flooding but deficient pulse. The floating yang qi contributes to the red face, hot sensations, fever and headache. Generating blood counteracts this extreme yin deficiency, which will in turn correct this abnormal yang qi behavior. In TCM, there is an intimate relationship between qi and blood. Qi is said to be the commander of blood, while blood is the mother of qi. Qi generates, moves, and holds blood. Thus, a substantial dosage of a qi-generating herb is required in this formula. And in fact, the weight of huang qi used is 5 times the weight of Xue. By comparison, almost equal dosages of each herb are used in Xue Tang. Xue, in both cases, is the appropriate blood herb, as it both tonifies and invigorates the blood. Although only 2 herbs are used in this formula, we should note that the TCM model for the generation of blood and nutritive qi is heavily reliant on the stomach through which food passes, and the spleen which transforms it to qi. The generation of blood is equally reliant on appropriate nourishment. This is an aspect that's often overlooked in books on formulas, but in clinical practice, good TCM doctors augment their prescriptions with precise dietary advice, which will constitute an important part of the treatment. In this case, the doctor would encourage a diet of nourishing food that is easy to digest, especially broths based on beef or mutton. In TCM, historically and to this day, inquiring about a woman's menstruation has been an important part of diagnosing a woman's health. In ancient times, menstruation was considered an indicator of a woman's ability to have children, and regulation of flow was assumed necessary to assure a woman's fertility. So excessive menstrual flow was considered much more problematic in those times than it is today. On the other hand, severe blood loss after childbirth is certainly a critical situation. In modern times, it would be dealt with by means of a blood transfusion, something which would not have been available in the times the formula was created. So if we're to see the relevance of this formula today, we need to see it either as an auxiliary formula, or we should look at it in a more didactic sense. Again, let's compare this formula with Xue Tang. The syndrome for Xue Tang is fever due to blood deficiency and floating yang. This situation is more acute than the syndrome for Xue Tang. The patient's face is said to be red, compared to the lusterless pale complexion of the Xue Tang patient, who will exhibit features of weakness corresponding to a long-term problem. If we set to one side the Lao Juan scenario, we can examine the situation where there is heavy blood loss, perhaps in the aftermath of childbirth. Extreme loss of blood would certainly result in a pale tongue, and we can readily imagine a flooding but empty pulse, resulting from the heart trying to pump an ever-decreasing amount of blood to body tissues. However, serious loss of blood, or hypovolemia, results in cold limbs and pale skin, and would certainly be treated with a blood transfusion in modern times. So in general, this formula should mainly be considered more as a didactic formula. We will be able to see its purpose better when we examine the role of Xue and huang qi in formulas such as Gui Tang and Buzhong Yiqi Tang, which we will study later. Thank you for watching this video, and I hope you'll join me for future videos in this series.